We're back with the League of the Genuine, the only show on the planet where we discuss matters counterfeit. As always, we have a special guest every week to help you appreciate the problem at hand and to help understand and share experiences about the issue of counterfeits. Do join me in welcoming our guest, Dr. Faith Nabushawo. Nabushawo.
Yes, yes.
Meaning doctor. You're doctor. Welcome, Faith, to the show. I was looking at your CV, Deputy Secretary General of the Uganda Medical Association.
Sure.
How did you manage to have such a big position in a professional body, and yet you are only a few years into the profession?
Thank you for having me on your show. First of all, I'd like to greet everyone that is watching us at this particular moment. I've been in leadership all my life, all the years throughout school, and during internship, you remember serving as the Secretary General of the medical interns at that time. And after that, I was introduced into the leadership of the doctors under the Uganda Medical Association. And that's how I got into this position, because I trusted that my experience and role as the Secretary General of the Federation for Uganda Medical Association had built me for this role. And therefore, I dared taking it on. It's an elective position, and yeah, doctors in Uganda voted me into this position.
So it is therefore not surprising. I can tell you that as a lawyer as well, many of us, the seniors, you go to the lawyers' conferences or meetings, people of your age are the ones calling the shots. So no wonder that you get elected. So you've been serving Deputy Secretary General for how long now? It's
2 years now, and my term is coming to the end. And I've not stopped there. As the term comes to the end, I'm already contesting for Secretary General of the same association.
Substantive Secretary General.
Yes.
You're tired of being a deputy. You don't want to be a president.
No, I have to start one step at a time. I know from this role I can take on other bigger roles in the future.
Welcome to the show again. We are here to discuss the menace of counterfeits. Can you tell us about counterfeits in medical practice?
Medical counterfeits are a big issue to the public health and safety, not only in Uganda but globally. Some of the medical counterfeits in the medical profession include counterfeit drugs. I mean drugs that are fake. Either they are improperly made or do not contain the active ingredient or compound that is suitable to make it fit for the particular,
efficacy.
Yes, to give it efficacy. And the other medical counterfeits that we see and experience in the medical profession, people faking credentials and acting as doctors or healthcare providers when they really aren't. And
so you're talking about one,
fake
the
drugs,
hardware, the products themselves.
Yes, yes.
The drugs, and then the service.
And then the service.
So let's go to the drugs. How is it possible that I can buy a counterfeit drug when the import, the manufacture, the distribution, the sale of medicines is regulated? And medicines are not sold in a window market in a stall. They are sold in a licensed place. How then do we get counterfeits?
The issue of the counterfeit drugs on the market is quite big and alarming. According to the Uganda National Drug Authority, about 10% of the drugs on the market are counterfeits. And these include the anti-malarials that we find on the drugs. According to the WHO report, I read that about 250,000 children die annually due to the what? To the counterfeit drugs. Now the question is, how do they get onto the market? So why are people actually going for these drugs? The issue is you cannot tell a counterfeit from the real original drug. That is number one. It's very difficult for someone to tell that this is a counterfeit or it's a fake drug. And also these counterfeits on the market, you find that compared to the good drugs, the counterfeits tend to be cheap and therefore more affordable. So you find that people are easily accessing them, but the problem goes down to the regulators of these drugs and how they get into the market. You find that in Uganda we don't have what we call the national formulary. Now this national formulary, yes.
What is that?
In the national formulary, it's supposed to have a list of drugs that are licensed and accepted to be traded in the country. We don't have that, in as much as it was already
We don't register drugs that are allowed to go on the market. NDA doesn't.
In the bill, it was approved, but they haven't really implemented this.
Why do we, as a country, knowing the best practice internationally, why don't we have? What does it take to have that formulary or register? What does it take? Now
that goes down to the regulators and people concerned with implementing what has already been passed, because in the anti-counterfeit bill it was already passed that we have this national formulary, but the question is, why hasn't it been implemented? It has to do with the implementers or the people that are supposed to.
But why don't you, as the practitioners, the medical practitioners, why don't you say enough is enough? After all, you take a Hippocratic oath, which is supposed to ensure the safety of our eyes, basically.
Yes, and that's why, yes, we are supposed to advocate for the health and well-being of the people, okay? That's why you have bodies like Uganda Medical Association. I'll talk about that because that's where I understand well. Now, these bodies or medical associations are there to help in advocating for the best health practices in the country, and that is what we are doing.
But you're saying there is work to be done.
Yeah, there is work to be done. And
so right now, you're saying we are at the mercy of who? The way medicines are moving around. We are at the mercy of the importer, the manufacturer.
Sure.
It is quite... Okay, what else is a problem allied to counterfeits with the medicines? Apart from lack of the national formulary, what else is a problem that we need, the viewers need to know about?
The viewers need to understand that they need to get these medicines from a licensed outlets, places like pharmacies that have been licensed to issue these drugs. But if you keep going into the corners and thinking, oh, there is a shortcut, there is another way I can get them, that is where the counterfeits are what? Are lying.
Like medicines on a bus, do they sell medicines?
Yeah, medicines. I see people sell medicines on the bus. You take a bus and someone comes in and they are advertising, they're telling you about this particular medicine.
Some medicines are sold in the open.
On the street, you know.
I was in Nigeria and I saw some medicines, you know, in boxes, selling like vegetables.
Exactly. Now that is the problem. The people watching us at this moment, I will say this to you, that you need to go to the licensed places or outlets or pharmacies to get your medications to help curb the issue of the counterfeits on the market.
But I have seen operations by NDA, sometimes raiding pharmacies, saying that they are selling fakes. Are the pharmacies entirely safe? Don't we have fake pharmacists also selling us fake medicines?
When we discuss the issue of counterfeits, there is a lot that is happening. Much as the Ministry of Health, the National Drug Authorities raiding the pharmacies or different clinics to pick up these wrong dealers, we know that there are others that are sprouting day in and night. Okay, so I can only say or recommend that the NDA needs to do quite more. Have drug shops, they need to be closely regulated to ensure that they are actually operating under the required standards.
Some 15 years ago or so, I was involved in a case which was, there was a fight between the pharmacy profession and the medical profession, but the issue was about the drug inspectors. The pharmacists were saying that the inspectors should be people with some pharmacy knowledge. And I think NDA was, the ministry was saying, no. NDA was saying anyone can be an inspector of drugs. Eventually, we won and the inspectors are pharmacists. Do you think it's a weakness of inspection? We're not having sufficient inspection? That's why there are some fake drugs in the pharmacies also?
Yeah, there is an issue of inspection. That's why you find that there are very many outlets out there that are not actually licensed, but they are running normally. You see that. So until they are inspected.
But now, how am I supposed to know that this pharmacy which has opened this door, it is supposed to open or not? Is there some sign, something to look out for?
Now, that's why I take it upon the government. The government should ensure that it actually is supposed to ensure that every Ugandan, regardless of their financial status, access the right
quality medicine,
the right quality health care in general. So this has to go down to the government to ensure that it comes up with the necessary steps to combat
to do
this,
enforcement.
Yes, to reinforce these areas.
But don't you think that seeing as the Uganda Medical Association is represented on the board of NDA?
Yes, yeah. We have
so you are part of NDA.
There.
So
yes.
if NDA has a problem, you are part of the problem. You should not blame the government, even you, the medical association. You are there in NDA.
Yes.
Aren't you making enough noise in NDA?
Yes, we keep pushing them. We keep pushing them, and our advocacy will not stop soon until we see that our healthcare system is at that level where we want it.
We are back with the second segment. This is the League of the Genuine Conversations with me, your host, Fred Muwema. We are hosting Dr. Faith Nabushawo, Deputy Secretary General, Uganda Medical Association. You bring together all the doctors, clinic officers, nurses.
Uganda Medical Association brings together only doctors in Uganda. Those with the background of bachelors in medicine and surgery. Yes, well, pharmacists, recently they fought for the title medicine. They wanted to be addressed as, for the title of doctor. They wanted to be addressed as doctors, and it was approved.
Which ones?
Pharmacists. They are also called doctors, but they do not fall under the Uganda Medical Association.
So, Uganda Medical Association, are you an association of African medicine, Oriental medicine, Western medicine? Which medicine do you guys practice? And what's the difference between those three? Western medicine, for example?
Yeah, for us, as Uganda Medical Association, we are professionals. And
which medicine do you practice? Because I've heard of African
Western medicine.
Western medicine.
Yes.
Muzungu medicine of injection. Is this Western medicine also?
I read that it's a Kabuti herbal cough syrup, yes.
Is this Western medicine? It's written in English.
Herbal cough medicine.
It's written in English. So it is Western medicine, for example?
It's a traditional medicine.
Because what we understand as a traditional medicine is maybe you go to a local, something not packed like this. Some people may think African medicine is not packed like this. It has no label. It has no. It's just a herb.
No, this is a good one. It has undergone the stages and the right stages, and it has been approved for the.
So this is African medicine or Western?
Yes, it's a traditional herb. So it's herbal.
Does the medical association also deal with the practitioners who people who make this one or administer this one?
Yeah, we acknowledge the presence of what? Of the herbalists. We recognize their medications, and there is research that that proves that
it works. The herbal medicine.
Yeah, it works. Some of them actually work. Okay. Our only issue with them is that before they put them out there on the market, let them have their drugs go through the right channels, let them have them undergo a test by the National Drug Authority and other regulatory bodies to have this drug really approved for the market.
So you don't you minimize them because for them they didn't go to school? For you, you spent 5 years in medical school. These herbalists, some of them, I don't know, whatever schooling they have done, doesn't that cause some confrontation? Don't you have confrontation with them as doctors?
We wouldn't want to have confrontations with them, okay? The only time we will raise up against the herbalists, you know, is when they want to assume too much and take on too much that they shouldn't, okay? Like recently, I acknowledge the UNDA for coming up and taking up this guy that had established himself so well dealing in the herbal medicine, but he was misleading the communities by his big unjustifiable claims.
Like
okay?
What was he claiming?
Claiming an onion treats HIV, you know.
According to the research I've done, when you use 15 onions in a day, 5 in the morning, 5 afternoon, 5 in the evening, this one will combat the virus in a miraculous way. Because this is fire, there is sulfur here. The moment you crush these onions, you can crush them, pound them, or blend them. Mix in any food or porridge. 5 of them, drink. 5 in the morning, 5 afternoon, 5 evening. For 30 days, they will combat everything. They thin the blood, they wash the liver, they work on ulcers, any wound inside. So if you use them after 30 or 40 days, go for checkup. Just do it casually. Even if you are not infected, if you think you might have COVID-19, then use HIV. Do that, because all virus, this is excellent natural antibiotic and fungal antiviral. It helps to heal the ulcers, stomach cramps. It helps to clean the liver. It's the detoxifier, so it detoxifies the body. And when you take it, even the fecal matter and the urine, it will smell onions. But this is a very good combat for all these problems which have been surrounding us for long. We have our nature. Onions, don't use garlic, use onions. Use them 15 morning. That is overdose. We call it mega dose, which can help you. Use them on a daily basis without jumping a day. But there is a precaution for ladies. If you're a woman and you're still menstruating, or you're still in your evolution, please stop them for the 4 days. Then after that you can resume them, because the blood may continue to come. Or if you have a broken wound, an open wound, don't take them. Or you have been through, you have removed some of the teeth, rotten teeth. Stop them for 3 days until the blood can clot, because this one thins the blood. The blood moves faster to combat any bacteria which has affected you. And in fact, when you go for checkup, check your blood count. Okay, the CD4 count, check it. Even the blood will be thin and red. Once the blood is red, those who have dark blood, they have dirty colon, they have a dirty blood. So this is the one which can help you to clean you. So if you use them, this is just throw more light on this. That once you use them, don't listen to anybody, because health is in your hands, not in anybody. If you want to fight this, let us make a revolution. The man who invented the bicycle was tired of walking, and he said, I think let us make a wheels. Then people started modernizing it. Like now, I've already made powder of it, out of it. I made powder out of this. You can mix in porridge, you can mix in yogurt, plain yogurt, and the drink. This one can help you with diabetes if you take them religiously. we can fight all disease. Because health is ours. If you are taking onions, nobody will come and say, hey, no, these are the rules of this. This is food. I don't have a farm of onions. I don't own any farm for onions. I may be the one in my compound. But I don't claim that I'm the one, but this is just a glance. Why don't we use this? This is an alternative. If you use an alternative and it helps people, I think that's good. Even if you die, people will say, this was something which was done. So please, use them and see, this is food. It's all over the world. 175 countries grow onions. If you use onions, when they're in their raw form, they will make you more raw and you enjoy life. So please, take a precaution, take this. For women, I advise women and sisters and his brothers and our daughters, not to, when they are menstruating, they stop them. But you can even do it. Me, I do it, I don't have any infection. For 30 days, 30 years, I've not fallen sick. I run to nature, 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 nature. In Uganda, I don't think there's any doctor who has ever seen me in a clinic complaining about what? At my age, if I go there, say, you might have a prostate enlargement, how can it enlarge? The moment you are clean and you take these antibiotics, the natural one, God will be on your side. So thank you very much and take care. Do this. If you feel you don't like it, it's up to you, leave it. Because once you, there's a saying which really touched me, and it said that if you neglect information, that will be the worst thing you do to yourself. Take it, retry it, or leave it. It's up to you. It's your choice.
His TikTok videos were all trending, how an onion treats HIV. The people were asking him questions that are medical, and then the responses you find that they are.
And he gave an onion. But during COVID, you saw what happened.
Yes.
We were all given therapies, formulas for fighting COVID and the flu and everything. And many people, including myself, if there is a flu around, the first aid is an onion. So maybe the guy was right. Onions could be okay. But
there is no research that has been done to confirm that to confirm his claims. You cannot say that an onion actually cures HIV according to some of his claims, and there were very many claims that he was making that couldn't be comprehended, and he had to be arrested.
But an onion cures other things. It can cure
have other, you know, and I know it has an antioxidant, you know. It is good. It's not bad, okay? It's not bad, but it's wrong for you to come up and say, and make such claims.
But the herbalists are not fake, basically. You're saying they are okay if they can go through the protocols of NDA to get their products registered and standardized.
Standardized and registered.
They are okay.
Yeah, there are lots of them on the market. You find them even in the pharmacies, you know.
Okay. Now, for us lay people, anybody we see wearing a coat, we call him Musawa, we call him doctor.
Sure.
But in my reading, I have seen that you have different levels. You have doctors, you have medical assistants, you have nurses, you have... For us, we don't understand. When I enter a facility, everyone is a doctor. Can you help to break it down for us so that we don't get fakes in the facilities?
Actually, when I was growing up, and I hope many people still don't have this same mentality, people actually out there think that every male in the hospital is a doctor, and then every female is a what?
A nurse.
Is a nurse. Now, that is very, very wrong. In the medical profession, we have different cadres, and depending on your qualification, the things you do, you have to do things that will fall within your what? Your qualification, okay? When you walk into the hospital, you can find even a cleaner wearing their uniform. Now, the layman will not even understand who this person does in this hospital. We have the nurses, okay?
So what are the different levels? From top to bottom? Who is at the top in a hospital or a facility?
I wouldn't say who is at the top, because that would show that I'm saying that there is superiority. Who is at the top and
okay.
Who is low?
What are the different
when you find
levels?
that in the nursing department, okay, they have their own hierarchy, and they're all doing the very good job in the overall output of the what?
Of the service.
Of the service, okay? So we have the nurses, okay? Then we have the...
What is their role? If I go to a nurse, what should I expect from a nurse? They do what for me?
They provide care. For example, if the doctor has prescribed, the nurse is the one that follows up to ensure that the prescription has actually been given to the what? To the patient. The doctor has prescribed paracetamol. The nurse is going to take it up and make sure that actually this patient
Can a nurse give a patient first aid before the doctor comes?
Exactly, yes. In the nursing care, they are also taught things that they can do, okay? For example, if they receive a patient in a particular, say there are those first initial steps they can do in stabilizing the patient as they call or wait for the doctor to come in. Yes.
They will check the pressure.
They will check the vitals. Sometimes they can even give these drugs.
So nurses can work independently or they work under supervision of doctors?
I wouldn't say they work under supervision of doctors, but they have to work with doctors.
It's complementary.
It's complementary. They complement each other.
Then in the middle there, I hear medical assistants. Who are these ones now? Is that title there?
I've seen the nursing assistants.
What about medical assistants?
I've seen nursing assistants. Medical assistants, most likely they refer to the clinical officers. Yeah.
What is their role?
They can prescribe, you know. But they can prescribe, okay, they can do literally everything, but there is a limit to what you can do, okay? There is a limit to what you can do. Like me as a general practitioner, there are things that I cannot commit myself to doing. There is such a thing as a referral in the medical profession. Something that is beyond you, refer to a specialist, okay? So from general practitioner, we have now medical specialists. For example, a gynecologist, a surgeon, you know, an ophthalmologist, you know, now those are the medical specialists that we do have. The
reason I ask about the different classes of healthcare service providers is because we have an increase of cases of fake doctors, so-called fake doctors. In May 2023, some guy was nabbed in Kapchora Hospital. And he was busy, one, administering treatment, two, asking for money. How rampant is the issue of fake doctors?
The issue, one of the other big issue under medical counterfeits is what? People faking what? Credentials, claiming or posing as the doctors or healthcare professionals when they really aren't, okay? This is a very big issue. We've read media reports, like you just mentioned. People have been arrested, and that is a very big problem because the unsuspecting patient will fall victim to these quacks, okay? First of all, they are going to give you the wrong prescription, okay? The wrong prescription is going to lead to complications that would have been prevented with the right intervention from the right person. We see that even clinics themselves, you find that there are lots of clinics operating out there that are not licensed. They are illegitimate clinics, okay?
But they open and put doctors so and so.
Yes, and they are operating without, you know, normally.
Who is supposed to regulate that? KCCA, the local authorities, the
Ministry of Health, together with the regulatory bodies, the professional bodies that we have, are supposed to regulate these clinics. But in as much as they are doing so, there are still very many operating out there.
So do you go out as medical association and do some field inspections and lock up these guys?
That is not really in our mandate, but of course we are also in the various regulatory bodies. We have representatives there, okay? So we are giving ideas on how to curb this issue.
We're back with the third and final segment of the League of the Genuine Conversations, here with Dr. Faith Nabushawo, Deputy Secretary General of the Uganda Medical Association. These fakes, what does the Medical Association do in terms of disciplinary procedure? If you have a real doctor, qualified, licensed, but engages in unethical conduct, can you tell us what steps you do?
First of all, in Uganda Medical Association, we have someone that chairs what we call is the chair of the of ethics and professionalism. Once we get these reports, either through media or from people or individuals bringing this to our attention, this person, our chair of ethics and professionalism, will pick interest in the matter and will do an investigation into the matter. And if it is within something we can do about it to have it settled at that level, we will always do that. But if it's beyond us, of course, we are working with our regulatory council, that is the Uganda Medical and Dental Practitioners Council. We can help in forwarding these to the council to have them handled at that level.
So for you don't give sanctions to the errant doctor? You don't give punishments?
We usually intervene, and we have, because the doctors are under us, if they are our members, when we get the reports, we have to intervene and get to the doctor. Sometimes we find that if it's just a false accusation or claim, so once we come in and we realize that it's just false, and even if it's really, we're still going to operate with police, you know,
so
the
you
dental practitioners
give
council.
the doctor a hearing. Do you
Yes.
give the complainant, maybe the patient, a hearing also?
Yes. Sure.
You call a public hearing, and
Yes.
the accuser is there and the doctor is here, and then you hear the evidence and decide.
Yeah, and decide.
So, do we have the association, the medical association, weeding out a lot of these errant? Are we benefiting? Are we benefiting from your actions? Is there impact when you take?
Through our various advocacy. Now, the Uganda Medical Association is there not only to advocate for the well-being of the doctors in Uganda, but also of the patients that we are dealing with, of the population and the health care sector at large. Okay, so through our various advocacies, we are always helping in improving our health system, and I think that Uganda Medical Association is doing so much.
Like, for example, what are you doing? Because there are patients out there as we speak. Somebody is receiving a fake drip for an anti-malarial. The child is going to become anemic. The thing is fake. What are you doing to that mother who is suffering like that with those counterfeits? What outreach programs do you have that you can share?
As the association, what we can do when we find, when we receive such knowledge
Reports.
or information or reports about what is happening, we usually want to intervene, okay? Sometimes you have to send someone down on the ground to find what is the actual cause of the problem, and if the problem is existent, then what are the necessary steps that we can take to combat the issue? Yes.
Do you work with, I've heard of some patient organizations that look after the interests and welfare. Do you collaborate with them?
We have very many collaborators, because anything that has to do with the health of our people here in Uganda and the welfare of doctors, that is under our mandate. We are always collaborating with the various associations and NGOs to make sure that our actions lead to an improvement in the health.
To remedial measures being taken. But we have had foreigners coming here. A report of that unlicensed health worker, the American, who came and was treating children, I think in eastern Uganda, and some children were dying. Does Uganda Medical Association regulate foreign doctors also?
Now, the body that regulates doctors is the Uganda Medical and Dental Practitioners Council. Well, it was such an unfortunate story
that American. What did you do?
That American. Yeah, we saw that story, how she was arrested, having been found masquerading or posing as a health professional.
And action was taken.
And action was taken.
So our children are safe from from that issue.
From that particular person, not the whole issue as it is.
I also noticed that Uganda Medical Association, as one of its policy, the things you do on policy, drug formulation and so on. This issue of drugs is a very big problem. And yet every day we hear there is a fake morning after pill, postina. The other day you'll hear they are fake cancer drugs. Do you have any strategy as an association, as professionals? Have you come up with any intervention or strategy beyond us lamenting and crying we are facing this issue? Anything specific?
Now, one of the
to the patient, for example, to us. I heard you saying we go to the licensed place. What else should we do to avoid this?
Well, one of the things that we do as the association is we are actually present in these policy discussions, and we are always pushing to influence decisions that better our health system and protect the people at large. So participating in the policy discussions and pushing for policies that better the health sector at large is one of our issues, one of the things that we do.
Do you think we have an issue with medical education? Because in our time we had one school of medicine, Makerere, established in 1924. It was not until 60 years later that we got the Mbarara Medical School in 1989. Now we have over 13, maybe 13 medical schools, private and public. So you would have thought that with the increase of institutions that are training doctors, we should have better service, but we are still having challenges. How is the medical education impacting the quality of medical service in the country?
I wouldn't say that that the increasing medical schools are impacting the health care negatively, because actually we need doctors as a country. The population is growing, and we need more of these
doctors to come out.
These doctors, yes.
But the quality, I'm talking about the quality of
now,
the doctors.
With these new schools that are coming up, okay, we expect that they are being regulated by the regulatory bodies, okay? For example, the UMDPC is regulating them, but there has been a problem that has been noticed, okay? That actually the Ministry of Health is proposing that there be an exam at the
entry, like we had in law.
At the end, okay?
An exam at the end? At
the end, before pre-internship, before now you're released to do internship, okay? So it has been proposed as a quality control measure, but we would love to think otherwise. I think that the problem should be handled at the entry. If there should be an exam, then let it be at the entry onto medical school, and let them put more emphasis in regulating these medical schools. Let them ensure that the medical schools, before they operate, they have what it takes to train a doctor. I think that it's better that they put more energy in that than stressing someone after 5 years of medical school, and then what happens if I do the exam and I fail?
But then why should a medical school be licensed if it does not have the infrastructure and equipment?
Exactly. So we think that more energy should be put in in regulating the medical schools. If the school is not having what it takes, the minimum requirement to train doctors, then it shouldn't start in the first place.
But we have counterfeit issues in the provision of service. We have some health facilities that detain patients for non-payment of bills. You saw a recent story of a small kid who was taken away from the parents because there was a bill, and yet the Hippocratic Oath has one of its principles being justice. Maybe there's something called medical justice. So one thing is written and one thing is done. Commercialization has penetrated the provision of healthcare to the extent that our priority is making money and not providing healthcare.
But in that story, I want to think that the help was first provided before asking for the money. If it were the other way around, that they would demand the money before working on the baby, then there would be a problem.
But they held the baby. They had to go to court to release the baby to the parents. The Hippocratic Oath allows to hold the patient and a baby, moreover, and detain it until payment is made. I think that was a problem of commercializing of the service more than providing health as a priority. Would you agree?
I still wouldn't agree, because the service was first provided before the money was asked.
Okay, but is it right to hold the baby? For me, that's my issue. Should you hold the baby?
No, that was wrong, because first of all, this baby needs to be bonded with her parents, okay? It was really wrong. It was quite rigorous. I think that they should have come up with better ways of how to get the money after the service had been provided.
And what would be the best way? Because you know many people don't want to pay, maybe. So, and then you're running a business. You have doctors to pay, you have medicines to pay for.
Yeah, rent.
You have rent, you have everything. So how do you balance that conversation? How do you balance the public interest to provide a service and secure somebody's health, and also the interest of an entrepreneur to run their business and make a profit?
First of all, I want to commend that particular person for first offering the service before demanding for the what? For the money. That shows that they were acting within the oath that we saw when we are starting practicing, okay? There are very many ways he could have got the money from the caretakers of the what? Of the child, without taking on such a very big, you know...
It would have been worse, in short, if the child had died or
got other issues while they are under their custody. Yes.
Because of liberalization of education, many professions have got the floodgates opening. Anybody can be a lawyer, anybody can be a doctor. Is this the same with doctors? If I have my money and I can pay for the course, I just come and I'm admitted? Or there is some criteria?
There is a criteria. First of all, you have to have the grades that get you into the medical school.
You must have done the biology and so on. I don't come with my literature and English.
You don't come with anything and then you get admitted, okay? Because that is being regulated. They are being checked before you can get in. Recently, we've seen the numbers of doctors graduating every year has been increasing from, you know, it keeps increasing every year. That is causing either a strain on the Ministry of Health in providing what is required to train the what? The medical interns. That's why we, as Uganda Medical Association, are proposing and are having these discussions that let these medical schools be regulated. For example, you say this particular school, according to your capacity, you can only and only take in such and such a number of students per year. So that will be, with that, once you regulate the entry, okay, at the entry level, then you can plan and project further.
Lastly, the drivers of counterfeits that we discussed before: differentiation, affordability, convenience, concealed danger. What, in your experience as a doctor, as a youth, do you think is the biggest driver that is making the youth consume counterfeits?
On the medical profession, what I see is that the biggest is what? Affordability. you know. You find that the public healthy sectors or facilities are very few, okay, and the private hospitals are charging highly. So you find that many people are going to end up, you know, going elsewhere. You know, these fake clinics that have been established, you know, and also the fact that these drugs, okay, can be quite expensive, you know, while the counterfeit is cheaper. So we find that the population will find it easier accessing the counterfeit compared to the real drugs. And also ignorance, not knowing
the dangers.
Not knowing that, you know, you don't know what a licensed clinic looks like. Anyone that you see in a white coat, you know that whatever advice they are giving you is correct. So you're going to fall victim for such issues.
So don't you think we need to increase mass awareness?
Awareness,
things like what we are
yes,
doing now?
Yeah, there is need to increase awareness, okay, among the masses, so that they know that they are actually counterfeits, so that they can take extra caution when dealing with this.
Your message to your patients, to the audience, to the public about counterfeits in medicine, your message?
Finally, as we close this session, my message to you all is that we have to know and be alert of counterfeits. They are everywhere, even the medical profession as discussed. My message to you is that you have to be careful who you get the medical assistance from, okay? If it is someone you're really not very sure of, please, I will encourage that you go to an established or recognized facility or hospital. Finally, I call upon the government to come up with stringent measures on dealing with the counterfeit promoters on the market. Let there be measures, very strong measures in handling them. Also strengthening the anti-counterfeit bill. I believe that is the role of government. And also reinforcing these regulatory bodies to ensure that clinics or health facilities out there are closely monitored to ensure that they are actually licensed and offering services that are according to the available standard of operation.
Okay, so that has been Dr. Faith Nabushawo, Deputy Secretary General, Uganda Medical Association. These are the doctors in whose hands our healthcare is sitting. I'm sure she has done a good job to shed some light on the issues of counterfeits in the medical profession, the medicines, the fake doctors, the fake service. But her message is simple. Please go to licensed facilities, well-established facilities, where you can be assured of a good service, and where, if there is an issue, at least you can have a fallback position, a reference to be able to report. We thank you for being a good audience. As always, if you're new here, this is the only show on the planet where we discuss counterfeits in the various sectors of our lives. We appreciate those who have subscribed. Tell a friend to subscribe. We rely on your support. You can share any of the videos, and please do remember to give us the thumbs up and put that notification to be reminded about the next interesting episode. Until then, don't be fake, buy and sell genuine.